BCPH-produced webinar. Today, I, your host, Divine Favor Okebunner, a resolute advocate for public health and a candidate for a master's in public health at MCPHS University. I'm supported by our leader in democratizing public health through the lens of social justice to discuss the impact and challenges of watching a policy intervention initiative play out in real time. In 2024, California expanded its Medi-Cal program to cover undocumented immigrants, a move aligning with its status as a sanctuary state. Marketplace Morning Report highlighted that this expansion is expected to cost an additional $2.6 billion annually. While this figure appears substantial, it's essential to weigh it against the potential costs associated with increased aging and the homeless population lacking adequate healthcare. This policy shift offers a live case study, much like observing the human immune system response during the COVID-19 pandemic, presenting a unique blend of challenges and opportunities in healthcare innovation and equity. Public support for this expansion is strong, with 66% approval from Californians, as reported by the Public Policy Institute of California. However, with only 3 months of implementation, its long-term effects are yet to be fully assessed. Adding to the context are broader statistics on immigration healthcare in the United States. First of all, approximately 45% of undocumented immigrants in the United States lack health insurance, compared to about 8% of United States citizens. Secondly, immigrants are more likely to work in sectors without employer-sponsored health coverage. Third, nearly 1 in 5 uninsured residents in the United States is a non-citizen, including legal and undocumented immigrants. Fourth, immigrant households contribute significantly to public health insurance funds, paying an estimated $88 billion in federal taxes and $28 billion in state and local taxes annually. Undocumented immigrants use emergency medical services at a lower rate than US citizens, challenging the notion that they disproportionately burden the healthcare system. Providing healthcare access to undocumented immigrants can lead to earlier treatment of infectious and chronic diseases, potentially reducing overall healthcare costs by avoiding more expensive emergency care. Tonight's discussion will delve into these issues, assessing whether California's Medi-Cal expansion represents a pragmatic step towards health equity for older and lower income workers, or if it risks unintended consequences. We'll explore the societal implications and the lessons that can be learned from this historical policy move with our panelist today, Dr. Sanaya. He is a physician, Dean Scholar, and an MPH MBA student at Johns Hopkins University. He currently serves as the director of the Artificial Intelligence Club at Johns Hopkins Carey Business School. Dr. Sanaya is also a TEDx speaker and has been featured in the New York Times for his contributions during the COVID-19 pandemic. He's very passionate about creating a resilient healthcare system and leading at the intersection of health, business, and technology. Thank you for joining us today.
Thank you so much.
We'll begin with our first question. Given that undocumented immigrants contribute significantly to the US economy, paying billions in taxes annually, should they be entitled to the same healthcare benefits as citizens? And how might this possibly impact the overall healthcare system sustainability and quality of care for all residents?
Thank you for the question. It's a very interesting question considering the current situation which California is. I guess I'm able to hear my voice again. Maybe it's reverberating. Nonetheless, so as you mentioned, I would like to definitely touch upon the overview before getting into the question itself. So as you mentioned, since the policy was effective in 2024, the undocumented immigrants from age 26 to 49 became eligible for full medical coverage under the California's Medicaid program, Medi-Cal. Now, this program has evolved significantly over the last few years. In 2015, we saw that under the Governor Jerry Brown, the undocumented children were able to join the Medi-Cal program, and it was later on expanded to include young adults as well from age 19 to 25, regardless of the citizenship. And now we have the full expansion of the Medi-Cal program. So I would say that coming to the question of whether undocumented immigrants whether undocumented immigrants should be entitled to the same healthcare benefits as the US citizens is very complex in my opinion, and because it's dependent on several considerations. So I would say that on one hand, undocumented immigrants do significantly contribute to the US economy, or I would also like to take the opportunity to say that the US economy definitely stands on the shoulders of immigrants in general. Uh, and they contribute not just by paying in taxes, but also by working in several domains of the US health systems. So the question about whether they should get the same benefits as everybody else requires us to look at the bigger picture. So some of the potential impact of this policy change in California could be that providing healthcare benefits to undocumented immigrants could increase the financial burden on the healthcare system. And as we saw in the news, a lot of policymakers criticized this particular move by California, and because it, particularly if there's a significant increase in the number of individuals seeking care, since this could strain the resources and impact the system's ability to provide quality care for all the residents. The second question, on the other hand, is that providing healthcare benefits to undocumented immigrants could improve access to care for this population, the undocumented immigrants, which could have broader public health benefits. So when individuals have access to preventive care and early intervention, this could lead to better healthcare outcomes and thereby reduce the need for costly emergency care later on. The other question could also be that with the expansion of this program, it might affect the quality of care which is available for all the citizens of California. So there might be the case that the residents of California may face issues related to accessing care or may have long waiting times for healthcare appointments. So in conclusion, I would say that the question of whether undocumented immigrants should be entitled to the same benefits is complex and I would say has no easy answer. It requires a consideration on several fronts, such as ethical or financial and even practical implications for the overall healthcare system to ensure that if the healthcare system is prepared for such a policy change in the first place. Yeah.
You addressed the overview by expanding on the fact that this policy was expanded recently to include 29 to 46, but had previously had children covered under it. Acknowledging that fact or that knowledge, can we still say that there would be any compounded issue with wait times, especially since it was noted that undocumented immigrants have lower rates of actually going to the doctor or trying to use emergency services than legal citizens? You also mentioned costs, potential costs being reduced because we're reaching out to diseases ahead of time, so preventative, such as getting vaccinations. Wouldn't the possibility of getting ahead of communicable diseases and STIs also reduce costs and therefore address the possibility of a lower quality of care, as people won't need as much help in the future?
So the thing is that it's a big assumption that we are making. The assumption that we're making right now is that ideally, such a policy change would provide better medical care for undocumented immigrants and thereby significantly reduce the transmission or the rates of infectious disease transmission in this population. So it should, in the long term, lead to reduced emergency visits from the undocumented immigrants, or it should lead to reduced transmission of infectious diseases and thereby improve the quality of care or healthcare status for the entire state. So it is a big assumption here because we are not sure how the implications or like what the implications may turn out to be in the coming future. And since California is one of the few states, like is the first state to make this big policy change, we also do not have examples to draw upon as to how the effects might turn out to be. There might be unintended consequences as well on both positive and negative side. On the positive side being that uh, a lot of immigrant populations often engage into illegal drug use, which may be related to them not being able to access pain medications. On the flip side, it could be possible that California might witness a rapid expansion in their undocumented immigrant population size purely because the state provides these benefits. So we need to look at both the aspects, and I would say that only in the future, with more data, we would be able to make some concrete uh, judgments or switch gears or tweak the policy based on how the uh, response from the public evolves.
Thank you. So if we continue to watch and get more data as scientists, as we always should, at some point we may have to tweak the policy depending on what we see in the data and what results we have. Considering the disparities in healthcare access and outcomes for immigrants, especially undocumented ones, what ethical implications of the current healthcare policies exist, and how may we reform these policies to address these disparities? So, what possible tweaks can we make to policies so that we could address these disparities?
Um, Yeah, so ethical question is definitely an important one for public health professionals and policymakers to address because one of the concern, as I mentioned earlier, is that influx of the newly insured undocumented immigrants could strain the healthcare resources and lead to longer wait time or appointments for services for the US citizens. And additionally, if the resources are diverted to accommodate the healthcare needs of undocumented immigrants, there may be less funding available for services that benefit others. So from a policy standpoint, addressing this issue requires a careful balance between providing access to healthcare for undocumented immigrants and ensuring that the locals, so the US citizens, have the equitable access to care as well. So some of the potential strategies that we can use to tackle this ethical concern is that first of all, expanding the healthcare capacity, which would require significant increase in the funding for healthcare services and infrastructure. However, considering that the Medi-Cal has already expanded its budget and is already in fiscal debt, it may be a challenge or a question for the uh, State Department to identify how we can increase the funding for healthcare services to accommodate the infrastructure and healthcare needs of both the undocumented immigrants and the US citizens. Secondly, I would say that prioritizing care, so implementing policies that prioritize care for US citizens, especially for urgent or specialized services, could be something which can tackle the problem to ensure that the US citizens are able to get the services uh, on a priority basis compared to undocumented immigrants, while still ensuring that the undocumented immigrants have access to essential services. One of the other things that we can look at is that addressing uh, would be to address the social determinants of health. So things such as poverty, education, and housing can improve the overall health outcomes for both undocumented immigrants as well as homeless US citizens, and thereby reduce the strain on the healthcare resources. Um, from a policy standpoint, as we would be able to get more data, and we would be able to see what are some of the innovative policy solutions which we can use, either in terms of public-private partnerships or healthcare cooperatives, to thereby make sure that we are able to expand the access to care for both the groups, the U.S. citizens as well as the undocumented immigrants. Yeah.
For our audience, just to be more accessible, could you expand on fiscal debt, what it means, and its current implications in relation to Medi-Cal?
Yeah, so I was reading one of the nonpartisan Congressional Budget Office report, and in 2022, the um, federal spending on Medicaid was approximately 590 billion US dollars, which was more than 45% increase from the 2019 spending. These are just the figures I'm able to remember on the top of my mind. And so what I'm trying to say here is that, Medicaid in general has already seen an expansion in its budget requirements just in the last few years. And since we've already expanded the Medicaid budget significantly, further spending on Medicaid would be staggeringly high, and which might contribute to the additional financial burden on the government of California as well as the federal budgets. So we have seen some of the comments by in the news, for instance, that the plan to expand Medicare is fiscally irresponsible, as it would make the state of California, which is already in the budget fiscal deficit of roughly $68 billion, to go even further in higher fiscal deficit. And the thing is that since this policy change is going to require significant investment, roughly around 1.2 to $3 billion per annum, just to accommodate the additional expenses for the immigrants, it would be a significant move, and we are not sure how it would affect the taxpayers, or if the US taxpayers would be subject to additional tax because of this policy change.
I actually was going to ask a question about that, so thank you for answering that ahead of time.
Yeah.
If it was possible that the US taxpayer would then have to shoulder the burden through further taxes, would that then possibly affect their support for this policy once they realize that it would put more burden on them? However, at this time, we are not sure if that's going to happen. Addressing your second point about prioritizing US citizens, while that does logically make sense, would that then not lead to ethical questions of why would this particular person's life matter more than somebody else simply because of citizenship? How best would that then work in a social justice thinking or type of thinking?
Yeah, so I would say that prioritizing healthcare would be divided into emergency or urgent and non-urgent causes. So when we divide it in that way under the EMTALA Act, across United States, everyone, regardless of their status of citizenship, is able to get emergency care without an insurance at the Medicare specific hospitals in the United States. So for emergency care or urgent care, we are not talking. We are not. I do not suggest that one group should be prioritized over the other. When it comes to primary care, it could be something that we can tweak a little bit to see what are some of the ways in which we can garner additional support from the citizens of California, because I also believe that if we do not have all the stakeholders on board, and one of the big stakeholder group in this case are the citizens of California, if we do not have them on board, then the government may face issues or resistance in implementing this policy in the long term. So it would require I don't have a definitive answer of how the implementation of this would look like, but the state would either need to expand the healthcare uh, services so that we could accommodate all the citizens regardless of the priority, or do take a second step, which would be defining certain priorities for primary care, at least. Yeah.
I would invite our audience to then either ask questions or propose tweaks we could make to make that policy work. The Public Policy Institute of California indicated that enrollees must be below 138% of the poverty line. Could we discuss whether this threshold adequately serves the migrant population in need? How might the policy evolve to better cater to the broader public?
Okay. Yeah, that's a good question, I would say. So to give everybody a little bit of context about the federal poverty line here, so the 138% federal poverty line threshold for enrollees, as you suggested, um, uh, has been true for several states where for Medicaid eligibility based on the income levels. There's one state, if I remember correctly, the state of Wisconsin, wherein the eligibility criteria is 100% of federal poverty line instead of more than or equal to 138% of federal poverty line. Now, the question about how this policy would look like considering the federal poverty line threshold for enrollees. So I feel that the 138% federal poverty line threshold for enrollees may not adequately serve the migrant population in need, particularly the undocumented immigrants and those with a precarious immigration status. Mainly migrants, especially those working in low wage or informal sectors, may fall below this threshold, but still face significant barriers to accessing healthcare. So some of the better ways to cater to the broader public, including immigrants, could require the expansion of the eligibility criteria. So, for instance, considering expanding the eligibility criteria to include migrants with income levels above 138% federal poverty line, but who still face financial barriers to access healthcare. This could include undocumented immigrants and those with precarious immigration status. Um, Additionally, we also need to consider several legal barriers which prevent migrants from accessing healthcare, such as restrictions based on their immigration status. And this could require advocating for policy changes at federal or provisional level. Lastly, other things such as increasing the outreach and education or uh, collaborating with the community organizations could could be one of the potential solutions to better cater to the undocumented immigrants who may not be eligible based on the current eligibility criteria. So yeah, I would say that in conclusion, by expanding the eligibility criteria or improving the funding and outreach and education could be some of the ways that the policy can better serve the needs of the immigrant populations.
You mentioned collaborating with communities to better serve the populations. What could that potentially look like?
Yeah, so I worked on one of the projects, and I can give you this example, not here in the US, but back in India. And one of the things we saw that worked very well when it came to expanding healthcare for everybody, but at but limiting the costs through community collaboration was using the concept of mobile health clinics. So the mobile health clinics is something wherein we literally have a mobile clinic which provides which is run primarily by the physician assistants or nurse practitioners, and it provides primary care for immigrants or undocumented immigrants in certain pockets of the city or the state. And this could be one of the ways in which we can make sure that the healthcare is accessible for all the immigrants regardless of their immigration status. And the other thing could also be that engaging with some of the nonprofits could be one of the ways in which the governments can work hand in hand with the community organizations and ensure that the healthcare is accessible to undocumented immigrants as well as the US citizens.
Thank you. Mobile clinics have been utilized in some of the projects, especially in places where it's deemed dangerous, for hospital organizations or for workers to at least give vaccinations. So there is some precedent for working with them in the United States. So hopefully it's something we could work on. You mentioned that there's a possibility of a $68 billion deficit to the Californian government should this program be expanded further, and that would then lead to possible tax policies, increasing taxes for citizens. Other than that deficit, are there any other potential fiscal problems or impacts that may occur from this policy, or that you have seen currently as an issue with this policy?
I would say that in my understanding, the issue would affect both the federal as well as the state. So Medicaid is one program which is funded partially by the federal funds and partially by the state. So when a state or when the state of California decides to expand this program to include all the undocumented immigrants, the additional costs that comes along with it is something which needs to be divided uh, or which would need to be funded by the federal level as well as at the state level. So it would require additional discussions as to how the budget or the funding for this particular program would look like. So I would say that other than the increased taxes for the residents of California, we might also need to ask how it would affect the US citizens overall, because since the federal funding is a component of Medicaid, we also need to see that how the increased budget for Medi-Cal would affect the citizens throughout the United States.
Are you aware of the precise or ballpark approximation of how much the federal government funds to Medicare as compared to states? And can you give us some insight on that? Or
I might need to look at the exact figures, so I wouldn't want to quote any figures without verifying them here. Yeah, so it varies significantly based on from state to state. So yeah.
Thank you. Something that we should think about with doctors at or frequently at capacity, leading to challenges when it comes to accepting new patients or making appointments with your doctor. With the expansion of this healthcare coverage, how might the regular citizens in California experience changes in care availability? You already spoke on a possible reduction in quality of care and how we may need to change the prioritization model, especially in primary care. But then, would that then make there be less availability for citizens before we make those changes, or even after those possible changes are effected, would availability be a problem people would still have to worry about?
I would say availability might be a big problem coming in the future because the expansion of the program is going to incorporate several undocumented immigrants. So yeah, so I would say that one of the ways in which the state could tackle this is by leveraging upon telehealth services, which could potentially improve the services or access to care, particularly in the underserved areas. So telehealth could help in reducing the need for the in-person visits and thereby improve the access to specialists for both US citizens as well as undocumented immigrants. However, this might be good in short term and long term, but in the long term, we would need to allocate additional funding support to in order to support the healthcare services for immigrants, particularly uh, in order to ensure that additional services which require the patients to be in the hospital or for any of the elective procedures, those are available for both undocumented immigrants as well as for the US citizens. So it is going to be challenging in the long term and short term. In the short term, utilizing either the telehealth or expanding the telehealth services could be one of the ways, or improving the coordination of care. And in the long term, um, improving the healthcare capacity through additional funding as well as efficiency could be some of the ways in which uh, doctors can, or the state can, tackle this issue.
Should this policy be adopted in other states, for example, say Massachusetts or in Maryland? Would you, as a doctor yourself, do you think that that would then lead to more openings for or more need for more doctors, leading to more doctors being hired, or do you think that will have no effect whatsoever on the amount of doctors that are currently working in the United States?
I would say it would definitely have an effect. Even without this policy in almost every other state, we are still like United States still needs significantly higher number of primary care physicians, primary care providers in several areas. Some states are more affected than others. I can speak for Maryland, and I would say that Maryland is in need for several primary care physicians, even without the implementation of this policy. So definitely, if other states were to adopt or increase their healthcare expansion to include undocumented immigrants, it would require preparation, before a significant preparation on the side of capacity building in order before implementing these policy change. Yeah.
In your opinion, um, would you say that more states should adopt this policy, or at least the sanctuary states should adopt this policy, or we should wait a while and get more data and get more results from this state that has adopted it first before we advocate for expansion elsewhere?
I would say that the question about whether the state should expand or not is much more complex than we think. So it would depend on several factors. And first of all, being that, does the state have the capacity to cater to the increased patient flow, which would result out of this expansion? That's the first question the states need to answer. The second, what would the budget constraints look like? So if the state were to make such a policy change, it would come with additional burden on the side of on federal as well as the state level. So how prepared is the state to handle the additional expenses that come along with it? The third question that the state would need to answer is that what is the current state of immigrant health, or undocumented immigrant health, and in that particular state? So depending on how severe the issue is, the state would be able to come up with an answer as to what extent and when is the right time to implement this policy change. And the fourth question, and probably the most important way of doing it, would be in steps. So expand, as the state of California did, I would say, since 2015 onwards, expanding the care for children, followed by elderly patients, followed by everybody else. So the stepwise approach is something which the states, if they plan to implement if they plan to implement this policy and expand their healthcare for all the undocumented immigrants, the stepwise approach would be something that the states would be able to easily implement, or implement with fewer barriers. So yeah.
Thank you so very much. It has been a pleasure to discuss this with you. As you've mentioned many times, immigrant health is something that is rather complicated. It requires a lot of thinking and a lot of maneuvering, both by the state and by federal government, to ensure health equity. At this time, we'd like to open the floor for questions from our audience. If they have any questions for Dr. Sanaya, our panelist today, we would invite them to put them into the chat. Dr. Sanaya, over the course of this discussion, would you say that you have found um, something you would like to explore more as a physician yourself, or a policy that you think needs more discussion and that you would be interested in joining the discussion for? And
Yeah. I would say that yeah, this policy change by California is historical in nature, and I'm excited to see how the policy evolves over time and what are the implications of this policy change on at fiscal level as well as at the primary care level or at the or in terms of access to healthcare. So I'm excited to see how the policy evolves and what are the changes we can expect or the level of access to healthcare by undocumented immigrants, which we're able to see in the future. So yeah.
thank you. Dr. Candace has a question.
Hi, thank you so much for that. And I really appreciated this discussion. I was just curious if you had a sense of, California's, taking the leap as being the first to be able to experiment with this policy. What other states do you think might take suit? Do you think other states would wait to see what happens in California, or has there been any other discussion amongst states that tend to have a larger amount of undocumented immigrants, where they're considering this and they might jump in the into the race before California has even had, say, a year or more to be able to see what's happened with this?
Yeah, great question, I would say. I feel that the New York City Department of Health has initiated conversations which I am able to see about improving the care for immigrant populations, especially in the Brooklyn or Queens provinces. So New York could be one of the potential states to take a leap into this and in order to improve the healthcare for immigrant populations, as the percentage of undocumented immigrants in the state of New York or the city of New York are significantly high compared to several other states. So that is my bet at this point, but I'm excited to see how this turns out. Yeah.
Thank you. We currently do.
Yeah, I don't see any additional questions in the chat, but Dr. Cersei, you look like you might have some questions brewing.
You're muted.
Thank you. I couldn't see that little line. This was an absolutely fascinating discussion. And as I was saying before we started, you're obviously like the perfect person to be addressing some of these issues. And you did so well and so depthly. I was just wondering, in terms of not only who's next, like because New York, we think of New York City, but just a massive state that has differences in like California in terms of some parts are more progressive than others and more willing and able and interested. What what recommendations would you have for like a community organizing group or another body that wanted to move forward with this type of policy to make it to realize it as legislation? Do you have any recommendations for groups like that, like what they need to do, what steps they should take to make this a reality?
Yeah, so I guess any community organization which is trying to advocate for this particular policy to be expanded in a particular state, it would require a lot of considerations or thorough research about how the state would go about implementing this policy. So let's take the example of Maryland, for example. If Maryland were to implement such a policy, and if I were a policy advocate group trying to pitch this in Washington, then one of the things I would need to do is to identify how the budget of the Medicare or Medicaid in the state of Maryland looks like, and how much of it is federally funded versus state funded, and what are the potential ways in which this expansion can take place, either at the federal level or at the state level. The other question to explore before we are able to pitch this policy solution is to truly identify the need or the number of immigrants or undocumented immigrants specifically in the state of Maryland to identify what is the current state of health, and thereby, I guess based on all these criteria or factors, we would be able to come up to a thoroughly researched policy answer, and that is when this would be one of the ways in which community organizations could work at the state level or the government level to pitch for a policy change, and thereby we would be able to see some of the changes implemented.
Thank you very much for that. And I didn't know if is it okay if I ask a follow-up question?
Of course, yeah.
Okay. So I was just thinking about sort of the ramifications or spillover effects of expanding healthcare to undocumented persons. Just thinking about things like folks who are in sort of the shadow workplace, for instance, folks who are working in factories or jobs that are very, dangerous, and sometimes people don't go and get help after they're injured, or they don't have access to care for other things. And then in the case of injuries, not wanting to get their employer in trouble because that would take away their means of support, and also perhaps get them, sorted out of the country. So I was just wondering, like, if you had any thoughts about that, or if there were other effects that we're not seeing as this type of policy may become more of the norm in the future.
Yeah, I guess the question about providing healthcare for undocumented immigrants may come with a lot of ramifications, in the sense that a lot of undocumented immigrants might be afraid to seek care in the first place, regardless of whether it's free or not, with the fear of deportation from the country, for example. Or how would this affect their legal status if they are living in any particular state as an undocumented resident? So these are definitely probable questions, and one of the ways in which the states can be protected, or the residents can be protected, is to have strong laws surrounding it to ensure that regardless of whether these undocumented immigrants seek care or not, their resident status or their job would not be affected. And if it so happens, then it should have legal implications for the employer or the state. So yeah, strengthening those legal barriers, or removing those legal barriers, it would be a way to ensure that undocumented immigrants access care in the first place, regardless of whether it is free or not at this stage.
Wonderful. Thank you for those insights. It's helpful.
So I'm saying this because during one of my research projects which was about the undocumented immigrants in Brooklyn and Queens, what we realized was that although the New York City Department of Health has several programs for these undocumented immigrants, these undocumented immigrants are hesitant in seeking care purely with the fear of deportation from the country. And in many cases, since they have limited English proficiency, they may not be aware of the ramifications without legal counsel. So I guess one of the ways in which the community organizations can also intervene and help is by making these undocumented immigrants aware of their rights, even like with the expansion or without the expansion. Every state in some capacity has provisions for seeking help or providing help, and yeah, immigrants may not be aware of these policies at all.
Oh, this is really helpful. Thank you for for this information, and also just relating it to your current work. It's fascinating.
You have been an interesting panelist, so thank you once again for gracing us with your presence. And to our audience, as we do not have any further questions currently, I will invite you to learn more from us, both from the BCPH Academy and additionally from our YouTube page. I would like to sign off and say goodbye, as this will be the final webinar we'll be doing, and with me as the host. Thank you for our interesting panelists for always joining us. Again, BCPH Academy is a wonderful place to find more interesting panelists as accomplished as Dr. Sanaya, and to see more of our esteemed directors, Dr. Candice and Dr. Cersei. And also to watch my previous webinars and see more of me. Have a wonderful night, everyone. Thank you for coming.
Thank you.
Nice job.
Yes.
All right. Thank you so much for that. That was great. And you definitely have sparked many additional rabbit holes that I want to go down in terms of, trying to be able to project what might happen in the future. So thank you so much for this.
Thank you for the report.
I'm sorry?
I was just grateful for the opportunity. I truly enjoyed this conversation, and I would say that it was really interesting for me to learn about a lot of things myself when I was researching on this topic. So yeah.
I personally appreciate the complexities you brought in, especially when you spoke about how it's not just like, an ethical thing we need to think of. There's so many other considerations, pointing out the step approach, with bringing kids in first and then elderly people. Like you said, it's, there's a lot to think about, and yeah, it is something that I'm going to be spending hours on. So thank you for joining us, and thank you for all of that.
Absolutely. Yeah.
All right. And yeah, we'll definitely keep you in mind for any additional things that come up, and hope you can continue to engage with BCPH. But good luck with your graduation and future.
Thank you. Thank you so much.
Thank you. Bye.
All right. Bye, everyone.
Bye,
I'll still
everyone.
be here, but I'm saying goodbye to the audience. I know we have some people who are still watching the behind the scenes. And we're still on YouTube, and I was not able to take that off. Sorry, YouTuber.